So how?
What's that?
Let's go back over the nerve. Can we go back over the nerve stuff?
You just did. No, I'm not going to go back over
Okay.
all those. Let me do the other questions. So just write them down, like obturator nerve, which muscles, what action. So just make a list like that. Obturator nerve, which muscles, which action. Femoral nerve, which muscles, which action. Inferior gluteal nerve, muscle actions. Superior gluteal nerve, muscles action. And then go down that way. Okay. Okay, is this a true statement or not? The rectus femoris is capable of causing flexion at the hip joint.
Yeah.
True. True.
The quadriceps femoris is made up of biceps femoris and the three vasti. True or false?
No, false.
It's not biceps, it's rectus femoris. Okay, so please watch out for those. Which Trendelenburg test would be seen, which of the following statements is false regarding Trendelenburg test? So, Trendelenburg test is positive when the person stands on the paralyzed side. True or false?
True.
True. Remember, when you stand on the paralyzed side, that side cannot act, so you drop, right? So that is true. Trendelenburg test would be seen if it would be seen as positive, or you can observe it when the superior gluteal nerve is involved, if it is damaged.
False.
No.
Inferior.
No, it's superior.
It is superior.
Oh yeah.
Which
It
must?
is superior.
Yes, because
Gluteus medius and
yes, gluteus medius and minimus
The opposite
are
way.
involved. So all of the
That's what I
statements
meant.
are
Yeah.
true in this.
Don't.
Which muscles are capable of causing, or a muscle capable of causing plantar flexion and inversion will be found in which compartment? Anterior of the leg, anterior, lateral, or posterior?
Lateral. What was that?
Flexion and inversion, you said?
Flexion and inversion.
Posterior.
Posterior. Remember, which muscle causes flexion? When I say plantar flexion and inversion, it is tibialis posterior. It's in the posterior compartment. Which muscle causes dorsiflexion and inversion? Tibialis anterior, right? Okay, so that's in the anterior compartment. So kind of write these down. That's why I tell you to, remember we did it last time and we did the leg and we did compartments. Anterior compartment muscles of the leg cause dorsiflexion, supplied by the deep fibular nerve. They also cause inversion. Posterior compartment of the leg, the muscles cause plantar flexion. They are supplied by the tibial nerve. They also, some of them cause inversion. So that's why if the deep fibular nerve was cut, you would lose dorsiflexion, but inversion would still be there because tibialis posterior is still around. Okay? Okay, which of the ligaments listed here is associated with the hip joint? Deltoid ligament, iliofemoral ligament, fibular collateral ligament, and oblique popliteal ligament. Iliofemoral. Femoral, yes. Which artery passes through the adductor hiatus? Femoral artery, yes. And becomes popliteal. In the popliteal, once it passes through, then we call it popliteal. It's not the popliteal which passes through. It's the femoral artery, okay? The popliteal vein passes through to become the femoral vein. It's the other way around with the vein. Which meniscus of the knee joint is more prone to injury?
Medial.
Medial.
Yes.
What are the important supports of the arches of the foot? Supports of the arches of the foot.
Propulsion?
Sorry?
Propulsion? Propulsion?
No, the supports meaning you have
Medial-
ligamentous
Oh,
supports, so ligaments,
Interfascial.
muscles, shape of bones, remember we just saw that, so they're all really important. Majority of the muscles of the foot are supplied by which nerve?
Superficial fluid.
Majority of the muscles of the sole, when I say superficial, of the sole are supplied by which nerve? Lateral plantar nerve, yes, lateral plantar nerve.
So what's the support of the arches of the foot?
The shape of the bones, the ligaments, the muscles, all those tiny muscles which are going, all of them. Okay, but all the muscles that you see in the gluteal region, okay, what movements are they capable of performing? All the muscles, or when you remove the gluteus maximus and you see the muscles underneath. Also, what movements are they capable of performing at the hip joints?
Lateral rotate.
Okay, lateral rotation, because you have those tiny muscles which are lateral rotators.
Abduction, extension.
Abduction, which muscles cause abduction? Medius and minimus, very good. Then? Extension, very good. Which muscles on the gluteal region would call it? Maximus, very good. Okay, any other movement you think of?
Stabilizes knee and.
Okay, through the iliotibial tract, yes. Okay, give me an example of a secondary cartilaginous joint.
Can you say that again?
Example of a secondary cartilaginous joint.
Yeah, you went back to the first.
Okay, you should know examples. Remember, secondary cartilaginous, all midline joints, between the sternum, the pieces of the sternum, the pubic symphysis, the intervertebral joints, they're all in the midline, either anterior or posterior. Sutures of the skull, what joint, what example? Fibrous. Synovial are all in your appendicular skeleton, all of these, elbow, shoulder, all of those. Dorsalis pedis artery is a continuation of which artery?
Tibia.
Anterior tibial, yes, anterior tibial.
Can you say that one more time?
Dorsalis pedis. You should know what are they continuation of. The femoral is a continuation of external ilia. Popliteal is a continuation of femoral. Then the popliteal divides into an anterior and posterior tibial, right? That one's in front, one's in the back. Posterior tibial goes and divides into lateral and medial plantar artery. So you know that order, okay? Where does the sympathetic nervous system have its origin? In which segments of its spinal cord or brain? You should know this. I'm not going to
We
tell
have
you
one
the answer.
class, we do have one other class that's crushing us, so that's.
Okay, you should know. That's where this is the
Just gonna
first
say
lecture.
that.
Where does the parasympathetic begin? The origin. And then the parasympathetic, what cranial nerves it's associated with. So this is something that you must kind of review, okay? Look at your bones, the skeletal system, the ossification. You remember you had something called primary centers of ossification and secondary centers. What's the difference between the two?
Diaphysis.
Okay, the primary center appears in the diaphysis, the secondary appear elsewhere in the epiphysis. Anything else? Primary appears first, of course. And it also, primary always appears in intrauterine life, when the baby is still in the uterus, when the fetus is still in the uterus. Secondary, for most part, all of them, there are a couple of exceptions, they all appear after birth. So they are extrauterine life, okay? So please kind of make sure you look at these, okay?
So what's the sympathetic nervous system? Where was
That's for you to find out.
Are you asking like for the preganglionic? Is that the answer?
No, sympathetic nervous system, you remember, parasympathetic and sympathetic have different origin. One is called craniosacral, one is called thoracolumbar. That's where they begin, remember that? Which muscle causes unlocking of the knee joints? Yes, very good.
What was the answer?
If the gastrocnemius and soleus was damaged, what action would be weakened?
Plantar flexion.
Plantar flexion. Very good. Okay. I think I've reviewed across the board, so some studying still needs to be done. I'm going to post today's recording